In individuals with profound sensory neural hearing loss or nerve deafness can benefit from something known as a cochlear implant. Basically, nerve deafness is some sort of problem inside the cochlea. So in previous videos, we looked at the structure of the cochlea, which is this round rolled in region right here. And we looked at the hair cells in the basilar membrane within the cochlea that eventually send signals through the auditory nerve to the brain. And if there's some sort of dysfunction within the cochlea, an individual is no longer able to hear. So a quick overview of hearing is we have the outer ear, which is this outer area right here that you could see. This is the outer ear. There's the middle ear, which is the canal, and then all the way to the eardrum. This is the middle ear. And then there's the inner ear, which includes the eardrum and everything up to the cochlea. So this is the inner ear. Sound comes into the ear, hits the outer ear, and is channeled through the canal into the inner ear. And this eardrum vibrates back and forth and then causes these bones to vibrate back and forth, and eventually it causes fluid within the cochlea to move back and forth. And then as the fluid moves back and forth, it stimulates hair cells. And these hair cells, depending on the frequency of the sound wave, different hair cells will fire and eventually reach the brain, and the brain is able to interpret the sound. But if there's a problem with the conversion of the fluid movement in the cochlea into an electrical impulse, then the individual is not able to hear. So this is where a cochlear implant comes into play. So a cochlear implant is basically composed of two things. First, there is the cochlear implant part, which is basically everything that is to the right of this line. So this receiver and the stimulator over here, which I'm outlining in red, and also the coil, which is inside the cochlea, are all surgically implanted. And this is all part of the implant, the cochlear implant part. There's also an outside part as well, and this is the speech processor, which I'm highlighting here in red. And the speech processor basically has two microphones, and the microphones take in sound. So the sound waves when something is speaking, so these sound waves, rather than going into the ear, they actually will hit the little microphone on the speech processor. And the speech processor will then transmit the sound waves in the form of an electrical impulse to a transmitting coil. So this right here, this round structure right here, which is on the outside of the patient's head, is known as a transmitting coil. So this is a transmitting coil, and the transmitting coil basically takes the electrical information that the speech processor is relaying to it and then sends it over to a receiver. And the receiver is actually on the inside of the patient's skin. So it's actually surgically implanted, and the receiver will activate this stimulating coil. And the stimulating coil is connected to an electrode array, and the electrode array sits inside the cochlea. And this electrode array actually activates, and different parts of the array will activate depending on the frequency of the sound. So similar to how the cochlea is tuned, there's a basilar membrane, we call it basilar tuning. The electrode array is also tuned so that sounds with a higher frequency will stimulate the base of the electrode array, so it'll stimulate over here, whereas sounds with a lower frequency will stimulate the apex. So once the electrode array is stimulated, it'll actually stimulate the auditory nerve, and the auditory nerve will send a signal to the brain, and that signal can then be interpreted as sound by the brain.